In May 2007, a diabetes patient portal was launched. The web-based information system has proven to be a success for both patients and doctors.
So the reason why patients develop type 1 diabetes is really to this day a mystery. It's quite clear that there is something about the beta cell in a patient who develops type 1 diabetes that is recognized as foreign by our immune system.
Beta cells are the actual cells in the pancreas that make and release insulin.
Now, within our bodies, we have special mechanisms and hormones and signals that regulate the control of blood glucose. And our lab is particularly interested in determining whether or not we can use those same mechanisms for the treatment of diabetes. Furthermore, these hormones have very exciting, almost magical properties in that they seem to be able to not only stimulate insulin secretion, which would be very helpful if one has diabetes, but they also seem to be able to grow new islet cells and prevent existing islet cells from dying. One of the major problems that patients with diabetes have over time is that their islet cells, which is really the factory for producing insulin, the islet cells that a diabetic has over time stop working, or in the case of patients with type 1 diabetes, are in fact destroyed. So we're very excited about the possibility that our body has messengers or peptide hormones that might be able to prevent the death of beta cells and possibly even be able to grow new islet cells. Type 1 diabetes, formerly known as juvenile diabetes, arises as a result of our body's immune system destroying the insulin-producing islet cells in our pancreas. Our research has been very fortuitous in that the hormones that we work on that are produced by our own body turn out to be very good potential treatments for patients with diabetes, not only because they increase the amount of insulin that the pancreas can produce, but they also have these stimulatory effects on growth and proliferation of islet cells. So potentially they might be able to regrow beta cells in a patient who simply does not have enough insulin-producing islet cells at that point in time. We've been working on this for almost 20 years, and it's only very recently that the clinical relevance of our research has become apparent. The first drug based on the peptide hormones that we work on, GLP-1, has been approved by the Food and Drug Administration in the United States in April and is now being sold in the United States. So at the University Health Network, we've been very fortunate in seeing some of the basic science research and discoveries actually being translated into clinical advances that might benefit patients. Furthermore, there's active investigation as to whether new types of transplanted beta cells, perhaps encapsulated to prevent the immune attack, might also represent an advance for the treatment of type 1 diabetes, and the first such transplants were also done in 2005 at the University Health Network. So this is not just a research enterprise that only deals with cells or preclinical models of disease. This is a place where basic science discoveries are in fact translated into potential new treatments and potentially beneficial to our patients with diabetes.
On February 22, 2005, physicians at UHN performed North America's first transplantation of specially coded insulin-producing islet cells into a patient with type 1 diabetes. Islets are insulin-producing cell clusters found within the pancreas. In diabetic patients, the pancreas does not produce enough insulin to regulate the body's blood sugar level. The study's goal is to have the transplanted cells produce enough insulin to control blood sugar levels to allow patients to either reduce or stop taking insulin entirely. Approximately 200,000 Canadians currently use insulin.
So I think this is a very exciting time for patients in that these discoveries made in the basic science labs are now being tested in patients.
Now with the insulin pump, it basically gives me more control over my life. So I'm able to function more appropriately. I'm able to like jump on my bicycle and go bike riding for like kilometers and kilometers and still feel fine, feel great.
Anti's determination to live with his diabetes led him to the insulin pump, which in turn has allowed him to rollerblade to work on a daily basis, pursue rock climbing, and complete a 75-kilometer bike tour of Niagara-on-the-Lake. But as all diabetics know, it was the discovery of insulin by Banting and Best that has proven to be the real gift of life. In September 2007, 9 years after being diagnosed with diabetes, Anti and his girlfriend Monica purchased their first home together. UHN's medical staff and researchers continue the long tradition of finding the answers. I'm Sheila Walsh. Thanks for watching.
But now with the pump, it's simply pressing a button or two and I get the insulin that I require.
Even though we might say that the insulin pump didn't change his overall blood sugar control, it had a huge impact on his lifestyle.
So although insulin is a great drug and in fact life-sustaining for type 1 diabetes, it is not easy to use, and it would be wonderful if we could find better treatments that would make life easier for patients with diabetes.